Your doctor has mentioned TEVAR to repair a problem in the large artery running through your chest. TEVAR stands for Thoracic Endovascular Aortic Repair. It fixes the aorta from inside without opening the chest. The thoracic aorta is the large artery carrying blood from the heart down through the chest to the rest of the body. Doctors use TEVAR for aneurysms, type B dissections, traumatic injuries, and other conditions that weaken the aortic wall. Candidacy depends on aortic anatomy, the access arteries in the groin, overall health, and any underlying genetic conditions. Before the procedure, teams review a detailed CT angiogram, plan the exact device size, and assess heart, lung, and kidney health. In the operating theater, the team makes small openings in the groin arteries to reach the aorta from inside. Under live X-ray guidance, the surgeon deploys the stent-graft, which expands and seals against the aortic wall. A completion angiogram confirms good blood flow through the graft and checks for any leak around it. Most patients are monitored in intensive care for a day, watching blood pressure, leg strength, and kidney function closely. At home, tiredness eases over 2 to 6 weeks. Walking is encouraged. Heavy lifting is usually avoided. TEVAR carries real risks including stroke, spinal cord injury, kidney stress, and leaks around the graft, called endoleaks. Lifelong imaging follow-up and blood pressure control protect the repair and the rest of the aorta. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.